Hello, this is Michelle from Physioactive Indonesia, bringing to you our Singapore Surgeon Insight series. Today, joining us is Dr. Desmond Ong, consultant orthopedic surgeon from the Shoulder Elbow Orthopedic Group, Singapore. How are you, doctor?
I'm good, Michelle. Good afternoon, and good afternoon to our viewers.
Thank you for taking the time to be with us today.
Well, I'm more than happy to share this topic on the rotator cuff, which is something I love passionately.
Okay, great. So today we will be addressing the Latissimus Dorsi Transfer, a method for surgical treatment of massive irreparable cuff tears. Doctor, let's start by understanding what a rotator cuff tear is, what can potentially cause it, and what are the possible options to tackle this issue.
Well, okay, Michelle, for the rotator cuff, it's basically a group of four muscles, and specifically for the cuff, it's the tendons of these muscles that is attached to the humerus, which is what we deem as the shoulder joint. And these tendons are basically what holds our arm to the rest of the body. So if we think of it in a catastrophic way, if all these tendons were gone, well, our arms will literally drop off our body. Um, Rotator cuffs can tear from either a traumatic injury, which is a bad accident, like sometimes a motorcycle accident, or it can tear from repeated use throughout day-to-day activities as well as with sporting activities. And the reason is because when we move, there's a lot of forces that go through the rotator cuff when we move our shoulder, and the tendons being made up of collagen don't have such a wonderful or rich blood supply like muscles or bones, and so its ability to heal itself is not as good as in most situations. So for an active sportsman or someone who does a lot of work with their arms in overhead positions, through the passage of time, then the tendon can slowly wear out.
Okay. And what are the possible options then to tackle this issue if a patient comes with a rotator cuff tear, doctor?
Okay, I think before we even talk about rotator cuff tear, patient for us we're talking about disease condition, so we talk of it as a rotator cuff tear. For the patient, the most important thing is when they get pain in the shoulder, because that's what is relevant to the patient. When I'm doing certain activities, especially overhead activities for our patients who participate in sports, this could be things like freestyle swimming, or this can be things like tennis, and then they will find that they get this discomfort and pain that they have in the shoulder. First thing is, do not ignore that pain. Don't put it down to I've been exercising too much, I'm getting older. Important thing is to get the doctors to check, because in the early stage, then treatment could be painkillers, resting it, icing it, physiotherapy. Sometimes, if they're a bit more severe in terms of pain, we can do injections. Today, injections to the shoulder, be besides the more commonly known steroid injections, then there are also things like platelet-rich plasma, which sometimes helps heal milder grades of injury. And of course, following the treatment of symptoms, a good session of physio to see what exactly is wrong. Sometimes it's our movements with the shoulder. We're just not using it correctly or moving it correctly. That's putting it at risk of damage. And so, while today we're talking about irreparable calf tear, I think my greatest aim is if we can help together with Physioactive, help patients understand how to look after the shoulder better, then this procedure maybe will be confined to just textbook chapters.
Okay, doctor, but let's talk about what if the injections, the physiotherapy doesn't help ease the pain? What is next then?
Okay, if if we look at tendons, there's a whole spectrum of injury. The painful ones, then the term would be tendonitis. It's an inflammation of the tendon. It's tendons inflamed because something has happened to it, and the body is trying to restrict our activities through pain, and it's trying to heal itself. So once we deal with it at the correct stage with rest, with painkillers, with physio, that should take care of itself. If it progresses a bit more, if physio and all these things don't work, then the concern is there is something a bit more irreversible in terms of damage, right? Like a tendon tear. And tendon tears can be from partial to full thickness tear, where the whole rotator cuff is not attached to the bone anymore, down to what we're talking about today, irreparable cuff tear, where the tendon has torn so much that there is no tendon to work with anymore, which is what we usually do in a repair, which is to try and put the tendon back together. Right? In irreparable tears, they've been neglected for too long, such that there's no more tendon left for us to work with.
Okay. Okay. So now, in the case where they do need to do, in the case of an irreparable cuff tear, and they would need, say, a surgery, or as the topic for today is the latissimus dorsi transfer, can you tell us the details of this procedure?
Okay, so again, we go back to the point about irreparable tear where the original tendon is so badly damaged that there is no way for us to put the body back to what it was before, right? So in terms of treatment, there is the latissimus dorsi transfer, which I'll talk about today. That in essence is us moving another tendon with its attached muscle to the replace the rotator cuff muscle. Because remember that rotator cuff is a series of muscle that attaches to the shoulder that provides stability as well as provide a means of moving the arm to allow us to say perform overhead movements. So when the tendon is so badly damaged, there's no way to reconnect the muscle uh, that is injured to the bone, right? So in which case we use a transfer, we bring in another muscle to replace that muscle that no longer functions. So that's the latissimus dorsi transfer.
For patients that come from Indonesia, what should their itinerary look like? Do they need to come and see you first? Do they need to get some imaging done? What happens post surgery? How long do they have to be in the hospital? All those details, doctor.
In terms of being the most efficient way of dealing with this, it usually the way it works is we'll have a telecom consult with a patient in Indonesia, because over the video, if we can get them to perform certain movements. Of course, if they've been referred by Physioactive, we will also already have eyes in Indonesia to let us know what the difficulties are in terms of the movement, whether some of these muscles, like the rotator cuff, is already weak. Sometimes in severe enough cases, looking at the shoulder, you can already see that the muscles have wasted quite badly to make it not repairable, right? Then of course, patients can send us their MRI for us to study, and then they maybe only have to make the trip over to Singapore for surgery. And of course, before surgery, we will see them do all the necessary pre surgical tests and run them through exactly what rotate, what the latissimus dorsi transfer is all about. For me, when I do this surgery, patients actually go home the same day. So it can be done as a day surgery. And in terms of wound care, there is minimum wound care because it's still done arthroscopically. So there'll be a few small holes around the shoulder, just like any arthroscopic rotator cuff. To get the tendon that they use, the latissimus dorsi, then there will be an incision under the armpit, kind of like here, a small little 2-inch kind of incision to get the tendon out, right? In terms of, so that's done, we put it in, and patients are encouraged to start moving the joint. So the surgery allows us to basically restore integrity to the shoulder, and patients can start moving their arms right away. So typically, if they come in for surgery, we see them a day before surgery, get surgery done. I like to see them about 2 days after surgery, just to make sure that my pain control is adequate, and then of course they are ready to fly back home.
Okay, and then when would they have to come again for their next follow up?
Okay, in terms of follow up, at 2 weeks, I would like to, of course, have a look at the wound. That can be done through teleconsult. So if patients have difficulty flying into Singapore just for a wound review, that can be done as a teleconsult. And then, of course, the moment they touch down back home in Indonesia from the original surgery, then we make the necessary arrangements for them to go through physio. So that basically is it. So it's almost a surgery where we get it done, they fly back home, wound will take care of itself. There's very little wound dressing that needs to be done. I typically would use some form of skin glue for the surface. So, and the stitches are all buried under the skin. So there's no stitches to remove. Dressing is quite straightforward, and then it's a matter of starting physio. So there is no downtime. They can start right away. Their physio can start the moment they're comfortable. Because I think if patients have had physio before, they will know that physio is not just about exercise. So in fact, I encourage my patients to start physio the moment they touch down back home in Indonesia. Because the initial few days to weeks, the first 6 weeks is the healing phase for the tendon, right? During that period of time, there can be a lot of muscle tightness issue, discomfort issue, swelling that the physio can help with. And then, even without moving the arm, there are a lot of shoulder stabilization, scapular stabilization exercise that you can do. So actually, this surgery is done with the intention of starting physio from day one, right? And then, of course, the subsequent review for me would be, yes, at 2 weeks we do a teleconsult just to make sure the wounds heal up nicely, and then the subsequent visits can all be teleconsult, because I would have physios supporting my surgery back in Indonesia that lets me know how patients are doing in terms of range of motion, in terms of their strength and how the strength is coming along. And of course, during teleconsult, we can get patients to perform some of those movements to see and corroborate the findings of the therapist.
Okay, so doctor, do you have any patient cases or anything else you would like to share with our viewers?
So that's those are the two criteria that sometimes makes tendons irreparable. Firstly, the tendons too degenerate. It's too retracted for us to pull it back to where it was previously, and the muscles have been wasted away so badly that even if we were able to successfully put the tendon back together, there's no functioning muscle units to move the arm.
Thank you so much for your time, doctor. And for our viewers, if you're interested to speak with Dr. Desmond Ong, you can find details of his WhatsApp, clinic phone number, and website in the description below. If you are planning to get your surgery in Singapore and live in Jakarta, you can start your physiotherapy at Physioactive Singapore and continue your rehabilitation program in Physioactive Indonesia. On behalf of our entire team at Physioactive Indonesia, we want to thank you for tuning in, and we look forward to bringing you more top quality content from leading industry surgeons. Thank you, Doctor.
Thank you, Michelle.